If you're enjoying this Med Prep to Go Step 1 podcast, you can now get the content along with the content of the Crush Step 1 podcast ad-free in one bundle. Just go to medprep2go.com and find our new subscription podcast called Med Prep to Go Step 1 Bundle.
In Walmart Sue time was ticking away. Only a few nights left till the big holiday. But last-minute gifters had no need to worry. Walmart Express Delivery got their gifts in a hurry. From Nintendo to Nespresso and Lego flowers, they could check off their lists in as fast as an hour. All of Newville, East, West, South, and North could order gifts up until 5 p.m. on December 24th. So this holiday, just do as the Who's do. With gift delivery this fast, they all gasped. From Walmart? Who knew? Subject to availability, terms and fees apply.
Building a portfolio with Fidelity Basket Portfolios is kind of like making a sandwich. It's as simple as picking your stocks and ETFs, sort of like your meats and other toppings, and managing it as one big, juicy investment. Now that's pretty good. Learn more at fidelity.com/baskets. Investing involves risk, including risk of loss. Fidelity Brokerage Services, LLC. Member NYSE SIPC.
Oh, Hilton stay, your beds are soft and cozy. No lumpy couch, no stiff futon, no shower line at crack of dawn. Oh, Hilton stay, a holiday you're saving.
When you want holiday comfort you can count on, it matters where you stay. This season, enjoy spacious, comfortable rooms and friendly service when you book with Hilton instead. Hilton for the stay.
This is Dr. Ted O'Connell with the Med Prep to Go podcast. Today we'll be reviewing 3 embryology questions. Just a reminder that you can find all of these questions and many more on our website at medprep2go.com. If you'd like to get involved in this project and learn how to develop questions, please email me at ted.medprep2go@gmail.com. If you like what we're doing, please subscribe to the podcast, give us a review, and let your friends know about it, as that helps us a lot. And if you want to find out more about me and my projects, check out tedxoconnell.com. All right, let's go ahead and get started with the first question. A 2-week-old boy presents to the craniofacial clinic for evaluation of facial abnormalities. After evaluation by a geneticist, he is diagnosed with mandibulofacial dystosis, also called Treacher-Collins syndrome, an autosomal dominant disease in which patients present with hypoplasia of zygomatic bones, hypoplasia of the mandible, conductive hearing loss, and normal intelligence. This syndrome is due to a gene mutation affecting neural crest cell migration into which pharyngeal arch? A, first, B, fourth, C, second, D, sixth, or E, third? The correct answer is A, first. Mandibulofacial dystosis, also called Treacher-Collins syndrome, is an autosomal dominant disorder affecting neural crest migration into the first pharyngeal arch. The first pharyngeal arch is innervated by cranial nerve 5, specifically V2 and V3, and is responsible for forming the maxilla, mandible, middle ear, and muscles of mastication. Answer choice B, fourth, is incorrect. The fourth branchial arch is innervated by cranial nerve 10, the vagus, and the superior laryngeal nerve, and is responsible for forming laryngeal cartilage, such as thyroid and epiglottic, as well as the pharyngeal constrictors. Answer choice C, second, is incorrect. The second branchial arch is innervated by cranial nerve 7, the facial nerve, and is responsible for forming the muscles of facial expression, the stapes, and the upper hyoid. Answer choice D, sixth, is incorrect. The sixth branchial arch is innervated by cranial nerve 10, the vagus nerve, and the recurrent laryngeal nerve, and is responsible for forming the laryngeal cartilage, the cricoid, arytenoid, corniculate, and cuneiform, as well as the intrinsic laryngeal muscles. Answer choice E, third, is incorrect. The third branchial arch is innervated by cranial nerve 9, the glossopharyngeal nerve, and is responsible for forming the lower hyoid and stylopharyngeus muscle. The key learning point of this question: in embryologic development, the first pharyngeal arch is innervated by cranial nerve 5 and is responsible for forming the maxilla, mandible, middle ear, and muscles of mastication. Question 2. A 29-year-old pregnant woman presents to the obstetrician for prenatal care. She is currently at 26 weeks gestation, and this is her first prenatal visit. Her pregnancy has been uneventful so far. Past medical history is unremarkable, and she does not take any medications. The in-office ultrasound indicates the presence of 2 anatomically separate fetuses with individual amnions. Further study indicates the twins are sharing a placental blood supply. Which of the following most accurately describes these twins? A, dizygotic. B, monozygotic, split before day 4. C, monozygotic, split between days 4 and 8. D, monozygotic, split between days 8 and 12. Or E, monozygotic, split after day 12. The correct answer is C, monozygotic, split between days 4 and 8. This patient is pregnant with monochorionic diamniotic twins. This is the most common type of monozygotic twinning. For this to occur, splitting must occur between the morula stage, day 4, when the chorion is established, and the blastocyst stage, day 8, when the amnion is established. Answer choice A, dizygotic, is incorrect. All dizygotic twins are dichorionic and diamniotic, as they are derived from 2 eggs and 2 sperm. This is the most common type of twinning overall. Answer choice B, monozygotic, split before day 4, is incorrect. Monozygotic twins that split before day 4 will develop separate chorions and separate amnions. This occurs in roughly 1/4 of monozygotic twins. Answer choice D, monozygotic, split between days 8 and 12, is incorrect. Monozygotic twins who split after the blastocyst stage, day 8, but before embryonic disc formation, day 12, are monochorionic and monoamniotic. This is a rare occurrence. Answer choice E, monozygotic, split after day 12, is incorrect. Monozygotic twins who split after embryonic disc formation, day 12, are monochorionic, monoamniotic, and conjoined. This is a rare occurrence. The key learning point of this question: in monozygotic twinning, the number of amnions and chorions depends on when splitting occurs, with key points being the development of the morula and placenta, day 4, blastocyst and amnion, day 8, and embryonic disc, day 12.
When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite, obey your thirst.
I know every operating system like the back of my hand.
I have 25 years of experience and have worked with several people from your company. I've been recognized for my passion. My team is everything.
LinkedIn delivers candidates who rise above the rest. With an up-to-date view into shared connections, skills, and interests you won't find anywhere else. See why 86% of small businesses who post a job on LinkedIn get a qualified candidate within a day. Post a job for free at linkedin.com/achieve. LinkedIn, your next great hire is here.
Question 3. A 4-hour-old term male infant is being examined by a neonatologist. The mother is 26 years old, Gravida 1, Para 1, and has no history of vaccination. She reports a few episodes of fever during the first and second trimester. Delivery was uneventful, and the infant was noted to have low birth weight. On physical examination, he is found to have absent red reflex in both eyes, a small head, and a continuous murmur over the left sternal border. Which of the following is the embryological origin of the structure causing the murmur? A. Allantoic duct. B. Bulbus cordis. C. The fifth branchial arch. D. The sixth branchial arch. Or E. Truncus arteriosus. The correct answer is D. The sixth branchial arch. Fever during pregnancy can have many etiologies. In unvaccinated mothers, rubella should be considered. This infant boy shows signs of congenital rubella syndrome. Clinical manifestations include hearing loss, heart defects, microcephaly, cataracts, low birth weight, and intellectual disability. One of the potential heart defects is patent ductus arteriosus, which presents with a continuous, machine-like murmur heard best at the left sternal border. The ductus arteriosus originates from the sixth branchial arch, which also forms the pulmonary trunks. Answer choice A, allantoic duct, is incorrect. This duct connects the dome of the bladder to the yolk sac during pregnancy. It regresses into the urachus. Answer choice B, bulbus cordis, is incorrect. The bulbus cordis elongates and forms three parts: the trabeculated portion of the right ventricle, the conus cordis, which is the outflow tract, and the ascending aorta and pulmonary trunk. Answer choice C, the fifth branchial arch, is incorrect. The fifth branchial arch involutes during development and does not contribute to the formation of adult structures. Answer choice E, truncus arteriosus, is incorrect. This structure forms the aorta and the pulmonary trunk. Key learning point here: unvaccinated mothers have an increased fetal risk of congenital rubella syndrome, which can present with bilateral cataracts, sensorineural hearing loss, and congenital heart disease, which includes patent ductus arteriosus. The ductus arteriosus derives from the sixth aortic arch. During embryonic development, this connection forms between the first portion of the pulmonary artery and the isthmus of the aorta. This provides a path through which fetal blood can be shunted away from the pulmonary circuit and delivered directly into the systemic circulation. After birth, the ductus arteriosus closes, and its remnant is referred to as the ligamentum arteriosum. A failure of the closure of the ductus arteriosus leads to a patent ductus arteriosus, also called PDA, which may be treated medically using non-steroidal anti-inflammatory agents or with surgical techniques. That's it for this episode, but please do check out our other episodes. A reminder that you can find this question and many more at medprep2go.com. And if you like the content of these questions, please check out the Crush Step 1 podcast.
Two kinds of phishing out here. One for fish, one for your data. Hackers try to hook you, but Cisco Duo keeps every user and device protected. Cisco Duo. Phishing season is over. Learn more at duo.com.